Welcome back to the Mic'd Up podcast. I am your host, Kahlie King, introducing today's topic. Florida has been talking recently about removing vaccine mandates for the school-aged children. Florida Surgeon General Dr. Joseph Labato announced Wednesday that the health department would take more steps to eliminate these mandates, calling them quote-unquote immoral, entrusting that hampering parents' ability to make health decisions for their kids. We are going to end it, Labato says, without providing details or a timeline. I have guests Kahlie McCarty, who is advocating for parental rights and medical freedom, who is advocating to get rid of the mandate. I also have Amelia, Deen, a pediatric and public health expert, who is advocating to keep the mandate in place. I'm going to give them opening statements so they could present their core arguments, starting off with Kahlie McCarty.
Hi, I'm Kahlie McCarty, and I'm an advocate for bodily autonomy and a parent's decision when it comes to their child's medical rights and decisions. I believe firmly as a parent that parents should have the ultimate say in what medical interventions, such as vaccines, go with their children. At the end of the day, it is a parent's right to decide what is best for their child in their specific situation. Generalizing large rules and mandates to get vaccinated strictly goes against what our country stands for. The choice to do what you want to do, to be free.
And now Amelia Deen will be sharing her opening statement.
Hello, I'm Amelia Deen, and I'm a pediatrician and public health expert, and I am advocating for keeping this mandate. I believe that getting rid of the mandate will result in increased risk of preventable disease outbreaks. I also believe that the population is at a more vulnerable health risk when they're not vaccinated.
To start off, are vaccine mandates still necessary in the big 2025? So Amelia, what has changed medically or socially that justifies keeping or removing the vaccine mandates today?
I believe that mandates ensure coverage, specifically this one. Without them, rates fall and diseases re-emerge.
My point of view is that medical risks are well known. Taking away the mandate doesn't simply take away the vaccine. If the parent still wants to get their child vaccinated, they are more than free to do so. But at the end of the day, it should be up to the parents in their specific situation.
Yeah, well, I think we should have left controlling parents in 2018.
For the next question, where do we draw the line between personal freedom and public health?
I think rights end right when they harm others. Unvaccinated kids can spread illness to those at risk, given that most of these children were born after the fact that everybody was suffering from the pandemic. Just because the people who did live through the pandemic adapted to the risks of it does not mean that it's completely harmless. It can affect all those people who were not affected by COVID as much, but also by every other disease that has been there prior.
I believe that governments shouldn't override family decisions, that mandates are basically medical coercion. You already have the choice to opt out of the vaccine mandates to enroll in public school simply by writing it off for religious reasons. We already have children in our public schools who are unvaccinated, and there's not total outbreaks killing all these kids. My question is, how would just simply taking away this mandate have widespread disease? It doesn't make sense.
What would you guys think if this policy was fully enacted in Florida? What do you predict will happen in the next 5 years?
I believe that people would feel like they have more bodily autonomy because they're able to decide what happens to their kids and themselves, not something that's they're being told to do by the government. Also, I believe that there would be more trust with the government because they're letting you do what you want to do. They're letting you have freedom in the United States of America. I don't think there would be a significant public health impact. As I stated before, there are already children in our public schools who are not vaccinated. And the children in our public school system are not dying from measles or polio or COVID-19. They are okay. Everything will be just fine without this mandate. It will just allow parents to have more freedom when it comes to the medical decisions surrounding their children.
I think that the drop in vaccine rates could result in possible disease outbreaks and have a greater strain on healthcare. Not getting the vaccines make the children more prone to developing these diseases. It doesn't completely get rid of it. That's the whole point of it being called a vaccine, not a cure. If you care for your children, you will make sure they're safe. Period, point blank.
As this episode of the podcast is coming to an end, we are going to let each one of the guests have a moment to share their closing statements.
It has been an honor being on this podcast, but I really love to share my rights and my opinions of this mandate. To sum it up, getting rid of the mandate will increase risk of preventable diseases to outbreak in the sense that without the mandates, immunization rates tend to drop, which reduces herd immunity and increases the chance of outbreaks for diseases like measles, mumps, polio, chickenpox, etc. Pediatricians and public health experts warn that ending requirements could reverse decades of progress. Secondly, the population is at a vulnerable and higher risk. People who can't be vaccinated because of medical reasons, infants too young to be fully vaccinated, or immunocompromised individuals depend on high vaccination coverage among the rest of the population for protection. Lastly, mandates create predictable vaccination rates and thus allows planning and prevention. Without mandates, variation across districts and countries could be larger, making control of infectious diseases harder. Also, outbreaks create downstream social and economic costs. Hospital burden, school closures, parental work interruptions, etc. This all affects you and your children. Get vaccinated.
Well, that was one good closing statement, Amelia Deen. And before I give mine, I'd like to thank Kahlie King, our host, for allowing me to come on here and state my case. First of all, I'd just like to say that this mandate has been in place for a while, but without it, Florida, and if we remove these mandates across all states, the country would be in a better state. Firstly, people deserve to have bodily autonomy. Parents should always have the ultimate say in what medical interventions, such as vaccines, their children receive. For example, Florida Surgeon General Joseph Lopatto has framed mandatory vaccines as an immoral intrusion on parental rights. Second, the government doesn't need to have this much power.
Thank you so much, Kahlie, McCarty, and Amelia Deen for joining me on this episode of Mic'd Up. If you would like to join in on our podcast stating your arguments, feel free to share your thoughts and comments through email or socials. Up next, we will be discussing even more when new information has dropped. Until next time.